an increased risk for breast cancer compared to those who don't have kids.
Now, research shows that risk can continue for more than 2 decades after giving birth. Dr. Mandira Mehra joins us from SSM Health this morning to talk more about that new research. Thanks so much for joining us.
Yeah, great to be here.
So this kind of flies in the face of everything we've been told in the past, right?
It's true. Every few months, I feel like I'm here saying, wow, if you have children, this is actually a protective factor against having breast cancer. And that's not totally untrue. So we really have to look at the fine print here, not just the headline. What we're really looking at is women that have just had children, really that 5 years after, and then up to about 23 years, you are at an increased risk of breast cancer. Somewhere around the age of 50 then, once again, having had children becomes a protective mechanism. And we don't understand all the nuances behind it. There's some philosophy, there's some science, genetics, hormones. But yes, the headline is true that having children could make you more susceptible to actually having breast cancer, at least in that initial phase. Now the question becomes why? What do we do with this information? Should we actually change how we childbear and the time course and our risk factors? Don't do anything yet. This is an interesting study. We need further study, but what it is interesting to say is that maybe we need better screening for that younger population that is having children, maybe initially in that 5-year period. Some of the reasons this could be happening is both hormonal, expanding breast tissue at a rapid rate. So anytime we have expanding tissue cells in the body, whether that's breast tissue or any tissue, you run the risk of increasing error. So that may be one reason that women are more susceptible after those childbearing years or after they've had the children to actually having that breast cancer. Again, this is a theoretical, so don't go out there and panic and don't try to not have children, but it's something to take into consideration, especially if you have other risk factors like family history or things like that.
Speaking of family history, we wanted to talk to you too about genetic testing when it comes to breast cancer and whether or not it's adequate. I mean, thousands of women or patients in general, I suppose, have hereditary causes that lead to them having breast cancer. What are studies showing now that we should be testing for?
Yeah, that's a wonderful question, and it's something that's constantly debated both in the scientific medical community, but as well as the insurance coverage financial community.
Sure.
Because some of this does come, of course, at a cost. Now, the important thing to remember here is that we hear a lot about BRCA1, BRCA2. So a lot of patients will say, wow, Dr. Mehra, you know, I heard about BRCA1, BRCA2. Should I be getting tested? So first of all, not everyone needs to get tested for everything. So we have to really look at the individual patient, your family history, your genetic risk factors. That being said, BRCA1, BRCA2 are one out of maybe 30, 40 commercially available genetic screens and tests available just for breast cancer. That's just sort of 2 very popular ones. That being said, we have to remember why we do these genetic tests. We do these because it can affect not only our treatment, but our cure rate. And so we're talking about a test being life-saving. Depending on the current guidelines from national cancer associations and different studies that come out, insurance companies then decide, should we cover this, should we not cover this? And that's what makes it readily available to us as consumers and patients. So we really need to talk to our individual physician and say, here's what my risk factors are, here's my family history, what options do I have in terms of genetic testing, and then seeing what is covered by insurance and what's not.
And that's definitely the barrier.
Exactly.
There, yeah.
2 really interesting conversations surrounding breast cancer this week. All right, Dr. Mehra, thanks so much.
Thanks, great to be here.
Good to see you. All right, so the state is making an investment to make sure trees along your property